Hello, my name is Maximilian Matzet. My candidate number is 7029. This is my presentation on human trafficking. Human trafficking is the exploitation of people through force, fraud, or coercion. It can take many forms, which is how my group split our work on. This includes sexual trafficking, forced labor, forced marriage, and organ removal. While sexual and labor trafficking are more commonly discussed, organ removal is less visible. This is partly because it often involves medical procedures which can make it harder to identify and prove. Organ removal trafficking involves the illegal removal of organs, the most common organ being kidneys. Victims are often targeted because they are in vulnerable situations such as poverty, debt, or lack of education. In many cases, traffickers promise money, jobs, or medical care, but these promises are either false or misleading. According to the U.S. Department of State, a highly credible source as it comes from a government organization dealing with global issues, this form of trafficking is a serious human rights violation. In some cases, victims may appear to agree, but this consent is not truly voluntary because it is based on deception or desperation. This issue is increasing mainly due to the global demand for organ transplants, which is much higher than the legal supply currently available. This issue is important because it connects multiple global systems, including healthcare, economics, and human rights. The issue being hidden also makes it harder to detect and solve compared to other forms of trafficking. The problem of organ removal trafficking goes beyond just individual victims. It affects entire systems. For victims, the harm is severe and often permanent. Many experience long-term health problems, including chronic pain, infection, or reduced ability to work. Some may even die from complications. There are also psychological effects, such as trauma, anxiety, and depression, especially because the victims are often deceived or forced into the situation. For healthcare systems, illegal organ removal creates serious issues. It undermines trust in medical institutions and can lead to unsafe practices. Hospitals may also have to treat complications from illegal surgeries, which puts additional strain on resources. Governments are also affected. They must spend money on law enforcement, healthcare, and victim support services. In addition, the presence of trafficking networks weakens the rule of law and can increase corruption. Finally, this issue increases inequality. It mainly affects poorer populations, while wealthier individuals may benefit from illegal organ transplants. This creates an unfair system where vulnerable people are exploited for the benefit of others. On a global scale, organ trafficking is a part of a larger international system of organized crime. According to the United Nations Office on Drug and Crime, a source credible due to it being an organization dealing with global crime, trafficking routes often involve countries such as Pakistan, Egypt, India, Turkey, and the Philippines. The highest detected cases are found in regions like Southeast Asia, the Middle East, and North Africa, and sub-Saharan Africa. My bad. These areas often have higher levels of poverty or weaker enforcement systems, which traffickers take advantage of. However, it is important to understand that organ trafficking is not limited to these regions. It is connected globally, meaning that demand in wealthier countries can drive exploitations in poorer ones. Another key issue is underreporting. Many cases are never detected or recorded, so the real scale of the problem is likely much larger than the official statistics shown. When we look at it on the local level, Florida has a significant number of human trafficking cases. According to the National Human Trafficking Hotline, a source credible due to it being a primary source for human trafficking cases, thousands of cases have been reported in the state over time. However, organ removal trafficking is not tracked separately in most data systems. This makes it difficult to measure how common it is locally. Even though we do not have the exact numbers, Florida is still part of the global trafficking network. This means that international systems can still affect local communities. For example, people in the United States may travel abroad for illegal transplants, or criminal networks may operate across borders. This shows that even if a problem appears global, it can still have local impacts. One important solution is increasing cross-border investigations and improving international cooperation. This includes sharing intelligence between countries, coordinating law enforcement efforts, and strengthening international agreements to combat trafficking. This solution works because trafficking networks are not limited to one country. If one country has a weak enforcement, traffickers can move their operations there and continue without being caught. By improving cooperation, countries can track and disrupt these networks more effectively. This approach is supported by the United Nations Office on Drugs and Crime, which emphasizes that global cooperation is essential to addressing trafficking. This makes the solution justified because it directly targets the global structure of the problem. Another important solution is improving legal organ donation systems. This includes increasing national donation programs, improving registration systems such as an opt-in or opt-out policies, and encouraging people to donate through public awareness campaigns. This solution focuses on one of the main causes of organ trafficking, which is the shortage of legal organs. When there are not enough organs available, people may turn to illegal markets. By increasing the legal supply, the demand for illegal organ decreases. This is supported by the World Health Organization and the Global Observatory on Donation and Transplantation, which both highlight the global gap between supply and demand. This makes the solution justified because it focuses on prevention rather than just reacting to the problem. My conclusion is that organ removal is a very underreported and hard to track crime, which makes implicating solutions a hard and lengthy process, and finding a definitive answer to the issue is difficult due to it mainly being on how many organs there are in supply. These are my sources.